Hello and welcome to the Ask Dr. Pickel show. I'm Dr. Jason Pickel, and for you who don't know me, I practice functional medicine, and I'm a board-certified chiropractic neurologist. So what we do is we help people who have chronic conditions, chronic issues where they've been from doctor to doctor to doctor and are not finding answers. So we try to help people find answers. And so today we are going to talk about brain health. So brain health is actually an exciting topic to me. So I really want to go through some basics, go through some things you can do also. But I think it's important that you understand about the brain, because the brain is, it basically controls everything. Everything in our body. There's not one thing that the brain doesn't control or influence. The brain, pretty important area of our body. We need it working, and there can be signs of when it's not working properly. So we want to let's get into some basics of this. And I want to start off here. In fact, let's go ahead and pull this up. All right. So when we get to the brain, of course, has brain cells. They're called neurons. That's what the brain is mainly made of. There's other what are called glial cells that make up a big portion of the brain too. And we won't get into the details of that as much. But these neurons, these nerve cells, they're pretty important. And they need some things to survive. In fact, when we think of these neurons, let's kind of do a little drawing here of a neuron, and it's not the perfect neuron. Let's draw. So this would be a neuron or a nerve cell, and of course it has a little nucleus in there in the middle, which is where our DNA is housed, and then also there's a little thing out here too called a mitochondria. And a mitochondria, I know it's this odd name, mitochondria, but I think it's a word that you should probably learn or get used to or learn more about, because it's pretty darn important. This mitochondria is where energy is made. Every cell in our body has this mitochondria. Actually, red blood cells don't have them in there, but we need these mitochondria is where we make energy. Energy in the human body is called ATP. So you don't have to know all the details of that, but just know that energy is important, and the production of energy is important, because that's what keeps the cell healthy. So we got to think, hey, it's all about the cell. If the cell's not healthy, nothing else is going to be healthy. If your brain cells are not healthy, things aren't going to work. And that can also be determined by certain areas of the brain. If I've got unhealthy brain cells in one certain area of my brain, that can cause a malfunction somewhere in my body, somewhere else in my system. So now on the end of this, there's the neuron up here. This whole area here is the main nerve cell. And then there's this thing that kind of branches out here. There's actually more of these. This isn't, a totally accurate depiction. But this thing is called an axon. And again, that's where we transmit nerve signals down. And then at the end of that axon, there's this area here, and where there's a gap. And then we have another neuron attached at the end of that. Well, not really attached. There's this gap here. And then this gap, that's where neurotransmitters are. Neurotransmitters like dopamine, acetylcholine, serotonin, GABA. Yeah, so neuron. Okay, so this neuron, what does this neuron need to be happy and healthy? It needs certain things. It's for our brain to work, it needs certain things. Because the opposite of a healthy happy neuron is a very unhealthy, unstable neuron. When a nerve cell is inflamed, isn't getting enough fuel, which we're going to talk about, it becomes unstable. It actually, we'll talk about what that instability means. What happens when a nerve cell becomes unstable? And if we have multiple nerve cells that are unstable, because usually it's rarely ever just one nerve cell, or we wouldn't really notice much. So it's usually this whole large amount of nerve cells or neurons that begin to have problems. So maybe a good example of this would be, let's say a person had a concussion. They maybe were in an accident where they hit their head or had a whiplash or something like that. So they got a concussion. And what is one of the symptoms of concussion that everybody kind of looks at? You know, when a person has a concussion, oftentimes the doctor will shine his light in the eye, or a person will say, hey, I'm sensitive to light. I'm sensitive to sound. I'm more sensitive to these things. And if you shine a light in their eye, you're going to see their pupils dilated. And yeah, they're sensitive. So, I mean, sometimes. But again, why is it so sensitive? Why does this sensitivity occur? Maybe to light, to sound? Because, you know, when people have had pretty good concussion, they're like, everybody leave me alone. I'm going into the bedroom. I'm laying down, turning all the lights off, blocking any light from coming into the room. No sound, no light. Even like when a person has a migraine, kind of similar thing sometimes. You want to shut down any external sensory stimulation because the nerve cell can't handle it at that point. The nerve cell becomes, let's say, again, unstable, kind of fragile at that point, and it can react. What happens is the reason why it reacts quickly and easily to sensory things is because when it's unstable, the nerve cell, what we call fires, it sends off signals. When it's unstable, it's sending off signals too easily. Normally, our nerve cell, it should take a certain amount of stimulation before it fires off. When it's unstable, it doesn't take much at all, and then it fires off and sends these signals out. So again, this is kind of the story of an unstable nerve cell, what we call fast to fire, quick to fail. And, you know, this could be sensitivity to smells. This could be brain fog, fatigue, headache, you know, just anything that's too stimulatory can affect the brain. Now, it doesn't have to be to that level. It could be at a lower level where it can cause other symptoms that we're going to talk about here in a minute. So then we got to say, what does this nerve cell need? What does a nerve cell need to survive? Well, it needs a few things. And in fact, we're going to kind of, in general, call these fuel and activation. Okay. What do those two things mean? All right, let's start off with fuel. So fuel means a couple of things. There's only two types of fuel in the human body. It's kind of like fuel in the race car. Our body needs fuel. One of those things is oxygen. You got to have oxygen. If you don't have oxygen, your cells can't function. You're going to die. So you got to have oxygen. We need it. Now, there's problems, though, that can cause, even though you're breathing, that can still cause problems where you're not getting oxygen to your cells. We're going to go over that. The other type of fuel is, well, let's put glucose in here. Glucose or blood sugar. When we think of blood sugar, it's not eating sugar. All the things that we eat eventually turn into fuel or blood sugar. Yeah, they also turn into vitamins and minerals and amino acids and things that we need too. But the main thing is food that we eat breaks down eventually into blood sugar, which is the form our body can use. So we're just going to say glucose there. All right. So what can affect our oxygen levels? If we're breathing, which most of you are, or you probably wouldn't be on this video or watching us. If you're breathing, then that goes into your lungs, eventually makes its way into your bloodstream. That oxygen does, and it's captured by red blood cells, which carry that oxygen to the cells of your body, especially these neurons. So we've got to have two things that occur here. Number one, we've got to have a good circulatory system. Our arteries have to be working properly. So one thing that can affect oxygen is blood vessels. If we don't have good blood vessels, if our blood vessels are inflamed, they're getting calcifications in them, they have clots in them. If a person has a blockage of a artery to their heart, not good. If this occurs in the brain, not good either. Now, can you still survive that and not even have symptoms? Yeah. What happens is the body does, when it has a blockage of a blood vessel, many people, the body actually starts to grow new blood vessels out from that area to help feed that area that's being blocked. So this hopefully happens. If it doesn't, then you can get symptoms and a problem. It's called neovascularization. You don't need to know that. All right. Another thing that can affect oxygen is anemias. And when we think of anemias, we typically think of iron anemia. Basically, our red blood cells use iron. Iron, when we eat something with iron, which iron's in almost everything. So it's usually not an issue of not getting in enough iron. It's usually an issue of you're not absorbing the iron that's coming in and it's not getting into your system. So, and that can relate to gut issues. So the thing is this iron goes in, it helps your body to manufacture a thing called hemoglobin, and that carries the oxygen to your cells. So yeah, if you have iron deficiency, another thing that could cause iron deficiency too is you're bleeding a lot. Maybe a woman is having heavy menstrual period a lot and they're losing a lot of blood, or you have internal bleeding that you don't know about. Any of these things can relate to iron deficiencies, but there's a lot. Usually I find majority of the time it's that the person's not absorbing it because something's causing inflammation in their gut. So, but besides iron anemia, what else can cause an anemia? Because when the iron's low, the red blood cell gets smaller, and it's called a microcytic anemia. We won't get into a blood test will show you this. If you get a complete blood count, it'll show you exactly what's going on there. If the red blood cell's smaller or if it's bigger. If the red blood cell's larger, we call that a macrocytic anemia, macro meaning bigger. So the red blood cell gets bigger and still has trouble carrying oxygen if you have a deficiency of B12, folate, or B6. Any of these things can also cause anemias. Now, there's also some other anemias like hemolytic anemias and some other anemias. We're not going to get into all these details. There's even called sickle cell anemia. So there's all these different potential problems that can go wrong with our blood cells. But the end result is we get less oxygen to our brain, and that causes these neurons to malfunction. So we need to have oxygen. Okay, so then we'll get to glucose or blood sugar. What's going to affect that? Well, if you have a blood sugar issue, if you're hypoglycemic, meaning you have low blood sugar, meaning that either you don't eat enough through the day, which many people will go long periods without eating and think that that's okay. And they wonder why they have health issues. Some people, though, and again, those people are usually using a lot of stimulants and stuff like that to get through their day. Now, also, but there is another side to that. If the body's working right, you can go long periods and you can actually do fasting, and there's some healthy sides too. So don't get me wrong. I'm talking about a person who has hypoglycemia, and it doesn't even have to be hypoglycemia diagnosed on a blood test, because these doctors are looking for a range where they're waiting for your blood sugar to get extremely low before they diagnose it. And by the time they diagnose it, usually you're passing out regularly and things like that. So we want to catch it early in the game. If I see a blood sugar below an 85, not good. So we can have low blood sugar. This will cause a problem. And a lot of times I find too, in many cases, it's not that the person's not eating enough, it's that they're not absorbing what they're eating. So mainly they absorb the sugars and carbs if the gut's inflamed. So, and that's like kindling on the fire. The body burns it fast, and then they get this regular dips and drops in blood sugar. Now, the other side of this story too is high blood sugar, or I'm going to put an IR here. That means insulin resistance. Now, insulin resistance could be pre-diabetes. Insulin resistance could be diabetes. It doesn't mean you're diabetic to have a blood sugar problem. You can be pre-diabetic. You can have insulin resistance, which just means that when you eat, your blood sugar is spiking high. You're making large amounts of insulin, which is inflammatory. And so now the thing is you can actually have both of these. You can have low and high blood sugar. Many people with gut issues or with chronic health issues have blood sugar that's called dysglycemic, meaning it roller coasters. So if you go too long between meals, it drops low. Then when you eat, it shoots up too high. And but any type of these blood sugar issues, whether it's low or high, eventually propels you into a pre-diabetes or diabetic situation. So we don't want that. We want stable blood sugar going to the brain. It's not that we don't want that. Even our brain doesn't want that. Our brain needs a steady supply all the time. Actually, our brain uses a little over 60% of our body's entire blood sugar. Yeah, that's it, the majority. It's quite a bit. So we need that steady supply. And the brain, if it doesn't get enough, it's going to cause symptoms, which we're going to talk about here in a minute. So we got to have fuel. This is critical, and we've got these two types. All right. So then there's this other thing called activation. What's activation? What in the heck does that mean? Well, activation of nerve cells means we're doing something to stimulate those nerve cells. And you know, as far as stimulation of nerve cells, we've got to do something. If let's say if you are sedentary a lot, let's say you sit in the lazy boy chair almost all day long, you don't really do a lot every day. Yeah, not good for your brain. Your brain will start to decline. Your brain needs activity. Actually, that's how the brain gets constant stimulation. The things in our environment, every time we do something physically, every time we touch something, I mean, we're constantly bombarded by things every day, all day long, stimulation. So this keeps our brain going. If we lived in a vacuum and we didn't have stimulation, our brains would degrade pretty quickly. And that's what happens when astronauts go into space. So they've got to make sure there's stimulation, because now we've eliminated gravity, which affects our brain. So I won't get into that too much. All right. But we need this. And not only stimulation, because let's say you're doing the same thing over and over. Let's say you are at a desk in a computer all day long, every day, repetitive things, day after day after day. Is this good for your brain? No. The brain needs novelty. It needs new things, new types of stimulation. The brain loves it, and it's extremely stimulatory to it when you do something new, when you change things up. When that's why too, you know, when people do something new or different, they'll even get increased neurotransmitter levels, and they'll be like, "Gosh, I really felt good after I did that," you know, or I really enjoyed this different thing, or I went for a walk out in the woods, and at first I was not very motivated, but after I did it, I was like, "Hey, I actually enjoyed that a lot." You know, these novel things. This is very stimulatory to the brain, so we got to have activation. Activation could, again, be anything from physical activity to mental activity, any types of things to stimulate the brain. Just don't do the same things over and over every day, and don't be super sedentary. Another thing too with that, well, I'm going to get into another thing, and we'll get to that. All right. So now, what can damage this? What can affect this neuron in a bad way? Besides, you know, if let's say our oxygen and our glucose or our blood sugar, they may or may not have problems, but are they really the causative issues here? Well, they are, in that we need them. But what influences them and what influences our nerve cells to malfunction? Usually these things are toxins in our body or our brain. Because remember, gut inflammation equals brain inflammation too. We've got toxins. We've got autoimmune conditions. This is where the immune system is attacking you. It can attack anywhere in the body and even the brain. This can create an inflammatory event. The thing is to find out what's provoking it, what's triggering it, what's causing your immune system to attack you. All right. And then also thyroid issues in particular. If you're low in thyroid hormone, whether you have undiagnosed hypothyroidism or you have Hashimoto's thyroiditis, or your medication isn't correct for your thyroid, every cell in our body, especially our brain, uses thyroid hormone. So you decrease that hormone, that equals brain degeneration. The brain has to have thyroid hormone daily, and it's got to have the right amount. So again, this is another factor that can affect this. And the other one, especially, now there's more possibilities here, but and some of these are mainly affected by toxins or infections. These are usually at the bottom of the list, and the major causes for inflammation in the body. And then just to even put a side note here, I'll put even gut, because gut issues, of course, equal brain issues. All right, so any of these things can be triggers for that neuron having problems. That neuron, that nerve cell or group of nerve cells or a very large group of nerve cells can start to malfunction and gets inflamed. It's now at that unstable level where it's just not functioning right, and any stimulation can be too much, and then we'll start to get malfunction on whatever those nerves control. So how would we know we have signs of problems of these types of issues? I would say, all right. So I would say a few things. I would say, some symptoms of this. How would we know, hey, I'm not having outright horrible concussion type symptoms. I'm not having migraines every day. But if you start to experience emotional symptoms that just aren't the typical for you, well, even if they do seem typical for you, it's still not good. But depression, irritability, anxiety, focus and concentration, these are all related to your neurotransmitters: serotonin, dopamine, GABA, acetylcholine. And there's a lot of, under these topics of each neurotransmitter, there's a lot of potential symptoms, but the general ones are usually if you have a low serotonin level, yeah, that can equal more depression. Maybe you feel like crying, loss of hope. Whereas dopamine can make you feel irritable, but that can also make you feel down and depressed, a lack of motivation. GABA, that's definitely going to affect anxiety, can make you feel like, hey, there's doom around the corner. And then, of course, sleep will be heavily affected by it, and serotonin. And acetylcholine, that's more focus, concentration, memory. Any of those things. So when your memory starts to fade, your concentration starts to fade, yeah, we've got to think of not only these neurotransmitters, but the areas in the brain that these neurotransmitters affect. Particularly paying attention to an area that's most susceptible to neurons malfunctioning, and that's the frontal lobes of your brain. This is your executive area of your brain, probably one of the most important parts of your brain, because it regulates everything else. So it's extremely tied into your focus, your concentration, your memory, your emotions. You're controlling your emotions, let's put it that way. So if I have an urge to do something, and it's like, hey, I really feel this urge to do this thing, but it is wrong, I should not do it. Your frontal lobes say, hey, don't do it, forget about it. But if those aren't working, then you do it and you may have a consequence. So again, we need the brain working for a lot of different things. Now, also some things to look at: mental speed or cognitive processing. Do you feel like, gosh, I just can't think as fast on my feet as I used to? I don't process information that comes into me as fast. Mental endurance, this is a big one. If nerve cells are not functioning right, if they're unstable and not working right, your brain endurance drops. You can't handle much. It's like people are talking to you, or you're working or doing things, and you got to say, hey, everybody leave me alone. I need to get away from it all. I need to go close my door, and I just can't handle all the stimulation, or I'm working and I'm doing things and it's like, hey, this is too much. stop it. I just can't tolerate it. Or this fatigue. Many patients will come in and say, gosh, I get brain fatigue or brain fog. These are signs of this. These are signs of brain inflammation, neuron instability. Also headaches. Another one with the brain too is a loss of creativity, where it's like, gosh, I can't even think of anything anymore. I can't be creative anymore. I can't, that's the brain having some problems. And problem solving, feeling distractibility, where it's like, gosh, I can't focus on this one thing. Something happened over here, and then something. And then here's the thing that occurs when people usually start to get these symptoms. What do they usually do? They look for ways to get fuel to their brain. So what's one way that a lot of people get fuel to their brain? Anybody know? All right, everybody knows this. Caffeine. So what do they end up doing? Coffee, tea, pop. So caffeine, what does that do? It does a few things. Yeah, it does dilate blood vessels, so you get a little more oxygenation in there. Caffeine actually, though, inhibits the neurotransmitter GABA in the brain. GABA is the one that keeps us kind of calm, or keeps the brain kind of more in that relaxed parasympathetic rest and digest mode. You add caffeine, you inhibit that GABA, and now these excitatory neurotransmitters work a little better for a short period of time, or more. Let's not say better, let's say more, because they're more uninhibited. And then suddenly we like, hey, yeah, I can focus a little more on the caffeine. The problem is the caffeine at a cellular level, at this neuron level, remember there's those guys called the mitochondria, pretty important. This is where we make energy. The caffeine causes problems there. It affects their ability to make energy and ATP. So what happens to you? If you keep doing caffeine, eventually you need more, and eventually you need more. And that small amount doesn't do it like it used to. May even need other stimulants. You may need nicotine, caffeine. You start to look at other things, or maybe you start to eat more sugary foods to get your blood sugar up quick. We start to look at these other things, and these are all signs that there's a problem. And not saying you can't have some caffeine, but if you're getting up there and you're drinking a certain amount, yeah, you're creating a worse problem for yourself in the long run. And these can be signs that those nerve cells, those neurons, are not working properly. And then you add stress on that picture, it'll make you not only crave those things more, but it also puts more pressure on a brain that's already inflamed and having problems. So what can you do about this? How do you help things like this? Which again, an important thing we've got to do when we look at these types of issues is we got to say, what's causing inflammation in the first place? Why is the brain why is it malfunctioning? Because you can go online and you can say, hey, what are some supplements I can take for my brain health, or to get myself more focused and concentrated, things like that. Yeah, you can take those things, and they may stimulate the brain. They may dilate blood vessels. They may stimulate some things. But if the neuron is inflamed, if there's something inflammatory going on in the brain, those either aren't going to work, or if they work, it'll be very temporary, or they'll make you worse. And you'll be like, gosh, I took that and it gave me a headache. The website is trash. They shouldn't have told me that information. So the thing we've got to do first, we've got to find out what's driving the inflammation in the brain. Is there a heavy metal or a toxin in there? Is there an infection that's causing inflammation somewhere in the body that's driving the immune system in the brain? Is there something in your body that it can't get rid of that's driving an inflammatory issue? And that inflammation is affecting the gut, affecting the brain, affecting somewhere else in the body. There's all these possibilities, but if you don't eliminate the cause, you really never get there. And you may get symptomatic relief for a period, but then you go back and it's like, hey, I really never got better. So, but again, I would say, number one, look at decreasing inflammation. Number two, supporting your neurotransmitters. How do you support production of the neurotransmitters? Well, keep your blood sugar good. Make sure you're getting in enough amino acids, which can come from meats or plants. Make sure that you don't have any anemias, that oxygen levels are good, and also that you're staying active. The thing that supports neurotransmitters and health overall, especially the brain, is exercise. Exercise is so crucial. If you exercise, you're increasing so many good things in your body. Now, the right type of exercise is important. I'm not going to get that right now, but just increasing physical activity, especially if it's novel, if it's something new, that's going to be even stimulatory to the brain. So we need it. But if you're inflamed and you've got a lot of other health issues, exercise could be detrimental also, because it could increase your inflammation. So there's kind of a two-edged street there. We've got to, if there's any doubt in your mind, if you're like, I went and exercised and I felt 10 times worse, and then I was in bed for 3 days, don't exercise until we figure out what's going on. So because there's a problem. You should feel energized after. You should exercise and be like, gosh, I felt great. I can't wait to get back again and do that again, because it makes you feel good. So supporting circulation, this can be things, of course, like exercise also. Circulation in the brain, there are certain herbs and botanicals that can be used. We want to increase what's called nitric oxide in the body. Now, one of the amino acids that goes into that is called arginine. So some people take arginine, and that can dilate blood vessels, and sometimes it can help with focus concentration. But if you have an inflammatory condition, arginine can turn into another thing called quinolinic acid, and that can make you worse. So there's other ways to increase nitric oxide too, other supplements and types of things to use, and even some herbs and botanicals that can increase circulation of the brain. But again, make sure the brain's not inflamed, because sometimes that can create some issues there. I think I talked about energy and blood sugar. Try to get those stable. Make sure you're eating through the day, snacking through the day. Diets that are great for the brain are like the ketogenic diet. The brain loves ketones. It burns those really well. It's very efficient with them. And many of my patients who do a ketogenic type diet, wow, they like, my focus and concentration just went way up. I feel so clear. And they really notice a difference. And that's also because they're taking out a lot of pro-inflammatory foods out of their diet, things that are inflaming their gut. As far as avoiding a lot of junk food, and then also if you're already fairly healthy, or sometimes with my patients, if I give them the go, fasting can be excellent for your health. You just take all the inflammatory products to a low level. You take all the pressure off your body. Many people, when they fast, which is more like a water fast, wow, they're like, I love feeling the way I do when I'm fasting. Maybe not the first 3 days until your body gets into ketosis, but that can be a really good thing. Of course, activation. We talked about activation, stimulating, so that's also exercise. Exercise. But again, doing novel things, doing new things, doing something that you don't do very often. Change your routine. Another great thing for the brain is using body parts that you don't use. If you're right-handed and you use your right hand for everything, start using your left hand. Use your left hand to brush your teeth. Use your left hand to brush your hair. It'll feel odd at first. It won't even work well at first. Try to even write with your left hand. But if you do it more, you're going to be like, hey, this is getting easier. I can do this with my left hand now. So the thing is the brain is plastic. It changes. If we use something more, it becomes more efficient with that. Those neurons, those nerve cells start to increase populations. They grow with the areas of the brain you're using. So to keep the brain novel, do some different things. Use those non-dominant hands, non-dominant foot. There's just so many things across the board you can do to stimulate that brain, and it doesn't have to involve, supplements and things like that. But again, if you have an inflamed brain, you may have to deal with that first. All right. So I hope everybody enjoyed this information on the brain and brain health today. Definitely share us on YouTube, Facebook, like us, and set up your alerts for when we come on. I really appreciate that. I want to get this information out there. We see a lot of patients that have these types of issues, and usually they've been from doctor to doctor to doctor, and nothing's helping. I had a patient yesterday they've already been to 8 doctors. Nothing's helping. So, we've got to find answers. And so we've got to look deeper at these other levels. We've got to look for the cause. And all right, well, I hope that helped. I hope everybody has a wonderful 4th of July. And God bless. I'll talk to you in the next video.